let's talk about mouthwash and what type of mouthwash and which one might be the best for you. So, my name is Andrea Turowski. I've been a dental professional for about 20 years now. And this is a question that patients ask me is what mouthwash is best? Should I even be using a mouthwash? And you might be wondering, do I use a mouthwash? So, yes, I do. And I'm going to explain a little bit about the different types and what might be better for you and why I use mine. So, it's definitely a marketing thing where there's so many different mouthwashes out there, but it's kind of like toothpaste. There are basically five of them that do different things, and it depends on what your oral health status is on what kind of mouthwash you're going to use. Is your mouth healthy? Do you want whitening? Do you get a lot of cavities? Do you have gum disease? Or is there a lot going on where you might need a little bit more? So there's different categories for mouthwash. For example, you can get one with alcohol and then another one with zero alcohol. But then you have to think, do you want fluoride added in there as well? And xylitol. So think of those key things. Now, mouthwash with alcohol, I suggest the one with alcohol if you have gum disease, if your gums are bleeding, if there's a lot going on, then the simple answer is get one with alcohol because it's going to do more of the work for you. However, having that said, the mouthwash that I recommended to all my patients is going to be a pH neutral mouthwash because what that does is it's going to keep the mouth in a pH neutral spot. So anything they're eating that might be acidic or anything like that, it's not going to allow your mouth to get a cavity if you're using the mouthwash appropriately. So there's no alcohol in a pH neutral mouthwash, but they tend to be more expensive. So without getting a prescription or without recommending a particular one for you, if you're not sure, get the mouthwash with alcohol in it because you're going to get the most bang for your buck. Okay. The ones without alcohol, again, it's kind of a marketing thing, or for those people who maybe you don't want to be around alcohol at all, then you want to get one with zero alcohol. It has been known if people have an issue with alcohol or they can't get away from it, they want it all of the time, it has been known that people drink mouthwash with alcohol in it just to get that little bit of alcohol. But if you're that person where you just simply want to stay away from it, or maybe you don't want the mouthwash that burns too much, then you want one without alcohol. Now let's talk about fluoride and xylitol. So I always recommend getting a mouthwash with fluoride or xylitol or both. What fluoride is going to do is it prevents the mouth from getting cavities. If there are any cavities in there before you start using a mouthwash with fluoride, it's going to help to remineralize those areas to make the cavities smaller if they're very tiny to begin with. If it's this big hole, well, you can't change a cavity now, but if it's tiny, you can actually remineralize those areas. So it's so good. It helps to protect the enamel and helps to prevent against cavities. Xylitol are for those people who maybe don't want fluoride, they want something more natural, so to speak. Xylitol is excellent because it's going to keep the mouth in a neutral state, a neutral position, and that's a good thing to help to prevent cavities as well. It just prevents cavities in a different way. So if you're eating something acidic or drinking coffee, drinking tea, or eating an apple, which is very acidic, having that pH neutral mouthwash with xylitol. So xylitol keeps the mouth at a neutral pH. So that is good to do, and that can also prevent against cavities. I personally like both. I like xylitol because that's going to keep my mouth in a neutral state, but I also like to add fluoride. So I love a mouthwash that has both. I love the fluoride component to help to make my enamel stronger and protect against cavities. Xylitol can't make the enamel stronger, but fluoride can. So I do personally like both. But there's also whitening mouthwashes out there. Do they actually work? Do I use one? How does everything work there? So with a whitening mouthwash, no mouthwash is going to change the shade of your teeth. The only way that can happen is with professionally applied peroxides, hydrogen peroxide, carbamide peroxide, just to name a few, but they have to stay on the teeth long enough to actually penetrate and change the shade of the enamel. But there are mouthwashes out there that claim to whiten the teeth, and they do have peroxides in them, but not enough to do anything. But they are actually pretty good in helping to keep the teeth white if they're already white to begin with. So how does that work? It adds just a little bit of peroxide in each time as you're swooshing around, but it's also going to prevent further stains from building up. So why not? Any of the other mouthwashes aren't going to have peroxide in them, such as one that's mainly for gum disease or one that says zero alcohol. They're typically not going to have peroxides in them because they're thinking about other things. Those are marketed to those patients who want a mouthwash but don't know what to do. They have gum disease, they have bleeding gums, or their dentist or dental hygienist just told them they need a mouthwash. But those patients that are specifically looking for a whitening one are going to look for that label that says whitening. And those are going to have peroxides in them, but not enough to really do anything, but they're great to help to repel stains. So why not? Now, what mouthwash do I use? I use a mouthwash purely for cosmetic reasons. I know it's not really doing anything, but I like that nice, fresh feeling afterwards. And honestly, sometimes when I'm in a rush, what I personally do is I'm going to swoosh the mouth with the mouthwash that I have. I personally like the one by Colgate. There's Optic White. Those just happen to be my favorites, but I just pick a mouthwash that I like the taste of it because not all of them I like the taste of. But what I like to do is I like to swoosh with the mouthwash, spit it out after like 10 seconds, and then I brush quickly. If I don't have a lot of time, but I kind of want to freshen up my breath and just have it look good for patients, have my teeth look good where there's not food caught. So that's what I do. But to keep the story short here, too, do you need a mouthwash? Maybe not. Talk to your dental hygienist, but also remember a mouthwash isn't going to kill the bacteria. What it does is it just helps to inhibit the numbers of bacteria. So it is helping you, but it's not helping you that much. Where for it to actually do something, you would have to swoosh with mouthwash literally every half an hour because that's what studies show that the mouthwash helps to inhibit the bacteria, so make bacteria less only within 30 minutes. So that's not a very long time, right? So you would have to be swooshing every 30 minutes to get the full benefits, but it can't hurt, right? It can't hurt. But what I don't want people thinking is thinking they can only use mouthwash and not brushing or not using the water pick, and that will help them. It's so much more than that. It's meant to be an add-on. But as you can see, there's so many different types out there. So feel free to comment below if you have questions. Which mouthwash might be the best for you because it really does depend on the person. What if you have cold sensitive teeth, plus gum disease, plus you get cavities? What mouthwash are you going to pick? Well, you're going to want one with xylitol, with fluoride, all of that combined. Or what if you just have cold sensitive teeth? The mouthwash might not be what you're looking for. You want a specific toothpaste that's going to stay on the teeth longer because mouthwash is just kind of in there for 30 minutes, but a toothpaste can last up to 12 hours. So toothpastes are kind of for another video. But let me know if any questions. Thank you for watching, and I'll see you guys in the next one.